I'm Fred Ododa from Nyandarua National Polytechnic. I'm a psychologist trainer, and today here we came to Lifebridge Mental and Rehabilitation Hospital with our students for an academic tour. Actually, it has been a good day to be in Lifebridge because we came to learn more about the psychological assessments, the psychological tools, and even the process of counseling, because this is mostly important for our students as we have those who are doing competency educational training. So it is good for their practicals so that they can come to understand what are some of these assessment tools that we use in counseling. And again, they have had an opportunity to also see the clients, interact with the clients, and see the real practical that we do in the field. So it has been an amazing day, and we are really grateful for this particular opportunity that we have had at Lifebridge Rehabilitation Hospital.
This is an amazing facility. It's a good facility for learning, and today we had an opportunity to take the students from Nyandarua through different topics, one of them being an assessment of a psychiatric patient, and we were able to look at how to take a proper history, which is important in the diagnosis and management of these conditions. And we looked at how to take a personal history, a family history, a psychosexual history, and we looked at the importance of this. And we're also able to look at the mental status examination and how to look at the appearance, the posture, looking at the cognitive functions of this patient, looking at the mood and affect. And this is important, especially when it comes to coming up with a diagnosis, formulating a diagnosis, and coming up with a management plan for this patient. And psychiatry has been quite interesting, especially in this facility, and we've been able to learn and interact with the patients, and just an encouragement to those who wish to venture into this area is that going into more research concerning different psychiatric conditions, learning about them, interacting with these patients, and understanding that mental health is an area that needs to be ventured more into, and it's a very interesting area.
Hello, my name is Cheryl Okumu. I'm a medical officer intern from Kijabe. Today, my discussion was on different types of psychiatric disorders using the DSM-5 diagnostic tool for mental health. So I think it's important that we're all aware of the different types of psychiatric disorders, not just for hospital settings, but also for self. Mental health has been an issue that's been sidelined for so long, and many of us struggle with some of these disorders that we do not have labels for. So just being able to understand some of the common psychiatric disorders like depressive disorders, bipolar, anxiety disorders gives us that power, being able to manage ourselves and our patients better.
Hi, my name is Naftali Lerukila Markat. I'm a medical officer intern working at Kijabe currently. Today I would like to talk about the common drugs that are used in psychiatry. We have antipsychotics, antidepressants, mood stabilizers, anxiolytics and hypnotics. These drugs are very important to stabilize the patient. So when one is started on these drugs, we need to adhere these drugs, and one thing we always tell the patient, take the drug at the right time, and there is a specific time that you need to take these drugs after you have become even stable or without symptoms. So you need to take drugs for a specific period that the doctor has instructed you to do. Some drugs might have side effects. So the first things, we always do close monitoring for these patients, and then we monitor for any metabolic issues like development of diabetes mellitus in those who are using antipsychotics, and also development of excessive weight gain for the same patients using antipsychotics. As we always encourage patients to to adhere to these medications. They say if there is no mental health, then there is no health.